Welcome back, even though this is your Miss Forte and health issues and stuff like that.
We are in it together.
DRASA, the Dr. Ameyo Stella Adadevoh Health Trust, is a non-profit organization working to improve and advance healthcare in Nigeria, particularly in the areas of infectious diseases and ethics. As I mentioned at the beginning of the program, of course, you remember that Dr. Ameyo Adadevoh is the doctor who saved many lives, and I mean many. She diagnosed the first Ebola case in Nigeria, and she worked hard to contain it in that environment where she found it and paid the ultimate price. It's my pleasure to welcome her sister, Deputy Director and Chairman, DRASA Board of Trustees, Dr. Ama Adadevoh. Good morning.
Good morning, thank you.
And with her is the MD of DRASA, Niniola Sholeye. Good morning.
Good morning.
And thank you for joining us.
Thank you for having us.
Well, you're the MD, so I think I better start with you. When was DRASA established?
Unofficially, we did a soft launch last October. After Dr. Adadevoh passed, we wanted to do something to continue her legacy, but more importantly, to improve the healthcare system and make sure that nothing like that would happen again. And so we unofficially launched last October, but we're having our official launch this October, this month.
So you've been at work for 1 year.
Yes.
Now tell us exactly what sort of things have you been involved in?
In the last 1 year?
Yes, in the last year.
Okay, in the last 1 year, we, first of all, like Niniola said, we decided that we wanted to make sure that Ameyo's sacrifice would be turned into something positive. And we made our focus strengthening the healthcare system in Nigeria, because we can't wait for others to do it. You know, we can't sit back and wait for other people to do it. We want to work towards that goal and continue her legacy of saving lives. In the last 1 year, we've done a couple of things. We have decided that one of our main initiatives is training of healthcare workers, because they are the core, they are the heartbeat of the healthcare system. And our plan going forward is we're going to collaborate with 3 institutions to set up healthcare worker training in Nigeria for healthcare workers at all levels.
So these 3 institutions will be?
Okay. So right now we are collaborating with Yale University in Ogun State, Nigeria. We will be focusing on training healthcare workers in infectious diseases and ethics. And I'm really pleased that Babcock University is willing to collaborate with us towards this goal. We also have the West African Infectious Diseases Institute, called WAID, that we are collaborating with right now. And
WAID.
That's the acronym. WAIDI. It's the acronym. So we're also collaborating with them, and the idea is on preparedness, because everybody knows that there will be some outbreak in the future. We don't know when, we don't know what it will be, and we can't afford another situation like what happened with the Ebola outbreak. I mean, Nigeria did well, and we were lucky that we didn't end up like the other countries who were devastated from their outbreaks. But going forward, we want to learn lessons from, you know, what happened in this situation and be prepared. So YD will be collaborating with us on preparedness for future outbreaks. And then the 3rd institution is the Perlman School of Medicine of the University of Pennsylvania in the US. They will be collaborating with us specifically for the infectious diseases training. And this is an Ivy League school and was the first medical school in the US, so we're really excited that they're willing to work with us.
Is that your school?
Well, yes. Well, the truth is that, yes, I'm an alum of University of Penn, so
well,
I'm proud to say that.
I didn't say anything.
Nothing. When we talk about clinical governance, particularly at the first consultant, then I knew Dr. Adadevoh was, at the forefront of it, and alongside, of course, other doctors.
Yes.
In that hospital, we also lost about 4 people,
Yes.
including Dr. Adadevoh.
Yes.
Why is it important to go into the training of these health workers in issues of infectious diseases?
Well, for example, Dr. Adadevoh was an endocrinologist. Her specialty was diabetes. It's rare that she was even able to diagnose that this man had Ebola. And the first doctor that saw him said he had malaria, which was a true diagnosis, but wasn't what he was presenting at the time. And so it's very important for us to make sure that all of our clinicians are able to easily recognize what they're dealing with, because, all it takes is one misdiagnosis for an outbreak to just spread. And with the population we have in this country, we just can't afford for infectious diseases to not be a priority for our health workers.
What is your background?
I studied clinical cognitive science and neuroscience, so I'm not a doctor, just into science.
You are in the loop.
Yes, I'm in the loop
somewhere.
Yeah, because at that time we were talking about Ebola, we had issues of health workers actually, well,
Yes.
I don't know if we should blame them, actually running away from the treatment center because nobody knows what this was, and if you touch and if you don't touch, then you really don't know how you're going to contract it.
Exactly.
So this kind of training, how far do you think it will go in preparing the health workforce for any possible future outbreak?
I'm so happy you asked that question. So just to go back to why we're focusing on healthcare workers, there's a big gap in training of healthcare workers in this country. That's one reason. And like I said earlier, the healthcare workers are the heartbeat of the healthcare system. Even if we have a fancy facility and we don't have trained healthcare workers, it's of no benefit to the patients. So that's why we're doing that. Now we want to, through DRASA, we want to introduce something called simulation training, which is like hands-on training. This is being done in many parts of the world, and maybe a few places in Nigeria are trying to introduce it, but it's not something that is widely taught in Nigeria. And it's been found that when healthcare workers are trained with simulation, they're better trained, the quality of their training is better, the patient outcomes are better, and the healthcare workers feel more confident after they're trained, with the simulation when they go into patients. So DRASA, that's one of the things we're trying to do, and University of Pennsylvania is going to assist us with that, specifically with simulation training, so they're doing hands-on. This is something that's been done a lot in the aviation industry. That's how pilots train, and they have a lot of success with that, and it's been adapted into medicine in the last few years. So it's still relatively new in medicine, but it's been proven that it leads to better patient outcomes. So we want to do that, because with something like Ebola, for instance, you have to do hands-on training. It's not something you can learn out of a book. So back to the Nigerian system, we were not ready at that time. So the healthcare workers were not trained. Even in the U.S., when the first, I don't know if you guys were listening to the story, when the first...
The one in Dallas.
Yeah, the one in Dallas. They weren't trained either. And the healthcare workers there, unfortunately, some of them contracted Ebola. They survived, but again, you have to be prepared and trained. That's why training is very, very important, and that's what DRASA wants to focus on.
Because even wearing the kits, there's a
protocol. Exactly.
There's a process to it, and touching people. We had people from outside Nigeria coming to help us, and I can imagine if they didn't come.
Yes.
So we need to put this in place.
That's exactly why DRASA is focusing on that, and it has to be hands-on.
Liliana, about how many health workers are you training at the moment?
At the moment, we haven't launched. So on the 20th of October, which is next Tuesday, we have our big launch event. And what we're doing is announcing our programs and our partners and everything that we're doing. And the reason we chose that date is because it's the day last year that Nigeria was declared officially Ebola-free by the World Health Organization. And, a week and a half ago, there was this scare in Calabar, Ebola possibly coming back. And, it's something that we still have to be very vigilant about. So at the event, we're going to have our partners with us announcing timelines and everything of what we're planning to do.
Okay, so how many health workers are you looking to train?
We're looking at, with WAID, for example, the training that we're doing with them, we're looking at 12 states and 1,000 workers per state through universities and hospitals.
12 states, 1,000 per state.
Yes.
Ooh.
Yes, lofty
Okay.
goals.
Yeah, we have lofty goals.
It's
Very
necessary. It's necessary for the population that we have in this country. That's what's needed.
I do agree,
Yes.
and that's a huge number. And
Yes.
what kind of outcomes are you expecting when you have finished? First of all, how long is this training going to last?
It's a two-week training.
Okay, and what kind of outcomes
Every
are you
year?
expecting?
No, not every year, just a one-time thing. In terms of outcomes, it's for the health worker to feel confident because, as you said, last year people were running away, and you can't blame them. They were not prepared. You can't.
They didn't know what it was.
They didn't know what it was. They
Exactly.
didn't know what they were dealing with. So
Yeah.
even for the confidence for the health worker themselves to be able to feel like I can deal with anything that walks in the door into my clinic or facility today. It's very, very important. It makes a difference.
And that will give the patients and the people confidence as well, that they know what
Exactly.
they're doing, they've been trained.
Yes.
So, we can go into the hospital or health facility and be confident that people know what they're doing and I'm going to be okay.